All right, so we're going to pick up with eating disorders, and here I want to focus a little bit more on bulimia and binge eating disorder. Um, Briefly, bulimia is characterized by binging and purging, and binging is eating very large quantities of food in a way that feels compulsive. So remember when we talked about OCD and the idea of what a compulsion was, it was a behavior that you felt would cause a lot of distress if you resisted engaging in the behavior. And so this doesn't feel like choice, it feels like automatic or compulsive behavior. This is not the same as eating lots of food because you're enjoying it so much that you can decide to continue even though you're getting full. This is sitting and eating and where there's no decision making as you go along about whether you're going to continue. And often the end of a binge occurs when the person physically can't put any more food in their stomach. Um, Purging might include anything that gets rid of calories or gets rid of physical food. So that could be vomiting, which is the thing we think about most, but it also could be laxative use, or it could be compulsive exercise, where you binged and now the exercise is the way of getting rid of it. So I just want to come out here again and look at the criteria. So the recurrent episodes of binge eating, it's characterized by eating in a discrete period of time, amount of food larger than what most individuals would eat in a similar period of time under similar circumstances. So if it's Thanksgiving Day, our similar circumstances is different than if it's not Thanksgiving Day, right? So it is important to know context, and you have to have both that and a sense of lack of control. So that's what we were talking about on that last slide. You also need compensatory behaviors, which is the purging behaviors that we were talking about. So you see the list here, and they both occur on average at least once a week for 3 months. So having one episode of binging and purging and that's it doesn't qualify you for the diagnosis. You need to have it once a week for 3 months running. So both a frequent and an ongoing behavior. You also, with bulimia, do get some self-evaluation that is, they say here, unduly influenced by body shape and weight. So this is not the same as the disruptions and the distortions in perception that we saw in anorexia, but this is somebody who believes that they're only lovable, for example, if they're thin and beautiful, and so that's different than the anorexia distortion. In anorexia, the studies, for example, that take pictures of women's thighs. So if you get a sample of women with anorexia, you take pictures of their thighs, you take pictures of other women's thighs, and then you show them the pictures and ask them to pick out their own thighs. And women with anorexia will fairly frequently pick somebody else's thighs that are larger than their own and think that those are their own thighs. And so that's the real distortion that we're talking about. And so here the disturbance doesn't occur during episodes of anorexia or exclusively during, which means anorexia is that if you meet criteria for both, then anorexia is the diagnosis that you get. And then we can look together while we have this open at binge eating disorder. Scroll down here. So binge eating disorder, remember, bulimia, we need the binging and the purging. In binge eating, we have these recurrent episodes of binge eating, and they are the same as the criteria for binging that we saw in the last, in bulimia, in the last set of criteria. But that's it. Like, we don't have the compensatory or purging behaviors. And then the binge eating episodes are associated with 3 or more of the following, right? So you need to meet 3 of these, and that you also need to see distress when the binging is happening, and it occurs again at least once a week for 3 months, right? And so here you see again not associated with compensatory behavior and not occurring exclusively in the course of bulimia or anorexia, which means that this is, if there's overlap, binge eating is the last one we go to. First we use anorexia, then we use bulimia, then we use this one if we're not clear about which diagnosis is best met by an individual. Right? So there we go. And so let's look at the physical consequences of bulimia. And here, what we're, that we still see electrolyte disruptions. We're not going to see the mortality rates that we see with anorexia because so many people with anorexia simply die of starvation. Um, but we do see still about 75% recover, so it's slightly higher, but 10 to 20% are going to continue to be symptomatic often throughout their lives, and continue to meet criteria for bulimia throughout their lives. The earlier we intervene, the earlier younger somebody is, or the earlier in the process of the diagnosis somebody, the earlier in the process of the disorder that we identify the disorder and intervene, the better the prognosis is. And so somebody who has had symptoms of bulimia for 5 years is less likely to do well in the long term when they begin treatment than somebody who has had symptoms of bulimia for 5 months. And so that's really important and also really difficult because families often don't know that this is happening. So, so imagine a young person who's doing this. People with symptoms of bulimia and anorexia and binge eating are often very secretive about their symptoms. And so that's an important thing to pay attention to and to know. And then when we have co-occurring disorders, we've talked about those in a number of chapters this semester, but where there's co-occurring disorders, so depression, anxiety, substance use, we also see less good prognosis. And so if bulimia is the only disorder that the person meets criteria for, then they're more likely to do well in the long term than if there's other disorders as well. And then I just want to go back up here to the issue of dental problems, that repeated vomiting causes the wearing away of enamel on the backs of teeth. It can cause damage to tissue in the throat because of the acid coming back up from the stomach all the time. There's also kind of, for people that are using their finger to kind of stick their finger in their mouth to cause a gag reflex, their knuckle repeatedly hits the same spot on their top of their mouth, and it causes a callus for many people. And so interestingly, dentists are often the first people to notice that there is a problem likely related to repeated vomiting because of the enamel problems, because of the callus. And dentists are often trained to respond in helpful ways with the patient, but maybe also to reach out to the family doctor, the general practitioner, to have further discussion about concerns about the person. Binge eating disorder doesn't have the same disruption to electrolytes or the same physical consequences that we saw with anorexia or bulimia. But people who have binge eating disorder are often obese because they're taking in lots of calories at a time, and then there's no compensation for that. And so what we see are the health risks that we see with obesity. And so it's still a health risk, but it takes kind of an extra step before we get there. And so this we looked at together. Let's see where we are. So the other, in terms of etiology with bulimia, is that that people with bulimia seem to have just at baseline low serotonin levels. And serotonin, like we think of, we've talked about it mostly in terms of how it might regulate mood and other emotional experiences, but it also is really present in our gut. And there's some indication that both in the brain and in the gut, that low level of serotonin might be related to not being able to feel satiated, not to be able to feel full and satisfied with food, so that if we have sufficient levels of serotonin, that helps us to think enough. I've eaten enough now and I'm good, whereas that might be missing or less sufficient with people with bulimia. And then the other thing that we can talk about here a little bit is the role of dopamine in terms of its connection to specifically anorexia. So we'll go back to anorexia here for a minute. That when we're all of us respond to the smell of food and the sight of food, right? You're used to saying, "Oh my God, that smells delicious," or "That looks so good." We take pictures of our food, for Instagram because of that. And there's evidence to think that restrained eaters, and in this case, that's almost always going to mean people with anorexia, though there are people with bulimia that restrain in between the binging and the purging, that they may release dopamine too quickly in response to seeing food, so that they're finding food rewarding before they eat it, which means you're then less motivated to actually eat it. which is interesting in its own way. And it may be, so when we see people, especially with anorexia, but also sometimes with bulimia, they're very interested in food. So people with anorexia may not be eating a lot of food, but they're cooking food for other people, and they're playing with the food on their plate, and they're talking about food and reading about food. And there's reason to believe that all of that is releasing dopamine in a way that is very rewarding, but that therefore they're not, they don't need to eat the food to get the same reward. And so I'm going to pause here, and in the next video we're going to talk about cognitive behavioral etiology, and then also talk about treatment.